care by private doctors among big changes urged for VA health system. 2 years after a Department of Veterans Affairs scandal involving long wait times at veterans' hospitals, an official report has found that the veterans' health care system suffers from profound deficiencies despite billions of dollars spent in recent years to overhaul it. The report says that the hospital system needs sweeping changes, including a program that would pay for all veterans to see private doctors. In a document nearly 300 pages long released late on Tuesday, the 15-member Commission on Care, created by Congress after the scandal, contained a list of recommendations to improve the nation's largest public health care system. Although care delivered by VA is in many ways comparable or better in clinical quality to that generally available in the private sector, the report concluded, it is inconsistent from facility to facility, and can be substantially compromised by problems with access, service, and poorly functioning operational systems and processes. The Commission, made up largely of healthcare professionals and leaders of veterans organizations, made 17 recommendations to streamline care, including modernizing computerized record systems and creating a team that could shutter underused or redundant veterans facilities. But the recommendation that would more likely have the most impact, and that has sparked the most debate, is the creation of the VHA care system, for Veterans Health Administration, which would include a nationwide network of healthcare providers including doctors from the Department of Veterans Affairs, military hospitals, and the private sector who have been approved by the VA. Under the proposal, any veteran could choose to see the Department of Veterans Affairs doctors or private doctors within an approved network. Currently, veterans must get permission from the agency to see an outside doctor, with only certain veterans qualifying. If implemented, the system would be only the latest effort to send more veterans to private doctors. In 2014, Congress created the $10 billion Choice Plan, which allowed veterans to go to a private doctor if they lived more than 40 miles from a veterans hospital or could not get an appointment within 30 days. It spent another $5 billion to hire and train more health care workers. While the Choice Plan has been used by thousands of veterans, its rollout was plagued by billing delays, with the overall time veterans had to wait for care increasing. This week's report predicted that 60% of veterans in the system could be using private care by 2034. While that could alleviate crowding at veteran hospitals, the report also cautioned that private care could cost nearly $100 billion more than the current system by 2034 if not carefully managed. Robert A. McDonald, the Secretary of Veterans Affairs, said many of the recommendations were in line with changes already underway, noting that veterans' hospitals had seen a record number of patients this year and that efficiency had improved. However, until all veterans say they are satisfied, I won't be satisfied. Nobody at VA will be satisfied, he said in a statement released by the department. Overhauling veterans' health care has long been a contentious issue. Some veterans groups have pushed for almost a total privatization and creation of a system that would resemble Medicare. Others have vigorously defended the current hospitals, warning that even partial privatization, as the Commission has recommended, would sap resources and create larger problems. 3 members of the Commission on Care refused to sign the report in protest and wrote dissents. Darren Selnick, of Concerned Veterans for America, a conservative group, and Stuart Hickey, former director for AMVETS, a lobbying and service group for veterans, said in a letter that they favored turning the health care system into a non-profit public corporation similar to Amtrak. They said the Commission's recommendations would do little to improve care for veterans.